Enlow's V principle, proposed by Dr. Donald H. Enlow, is a fundamental concept in craniofacial anatomy. This principle delineates the dynamic relationship between skeletal development and facial form. The V signifies the confluence of growth centers, particularly sutures, creating a framework that dictates facial proportions and harmony. The principle emphasizes the dynamic interaction between these sutures, especially at the base of the skull and mid-face, forming the cornerstone of facial growth patterns. Enlow's V principle is an integral part of the study of craniofacial growth. It describes the way our faces grow and develop. Picture a V shape. The top of the V is where the growth begins, and the arms of the V represent the direction of this growth. This is why it's called the V principle. But why does our face grow in this particular way? It all comes down to the biological processes of bone deposition and resorption. Bone deposition is the process where new bone is formed, often on the surfaces of existing bone. On the other hand, bone resorption is where bone is broken down, and its minerals are released back into the bloodstream. In the context of facial growth, bone deposition occurs at the bottom of our facial bones, pushing them downward and forward. Simultaneously, bone resorption takes place at the top of these bones, allowing for the upward and backward relocation of bone tissue. This dual process is what facilitates the V-shaped growth pattern that Enlow's principle describes. But there's more to this principle than just the direction of growth. Enlow's V principle also helps us understand how different parts of our face maintain their relative positions as we grow. Enlow's V principle delineates the differential growth patterns of the mandible and maxilla. The mandible undergoes complex growth patterns that are integral to facial development. According to Enlow's V principle, the mandible predominantly exhibits growth in forward and backward directions. The condylar and coronoid processes of the mandible play pivotal roles in its forward growth. The condylar process, located at the posterior aspect of the mandible, articulates with the temporal bone in the temporomandibular joint, TMJ. Growth and remodeling at the condylar process contribute to the forward projection of the mandible, allowing for the development of the lower part of the face. Simultaneously, the upward growth of the mandible is influenced by the coronoid process. The coronoid process serves as a point of attachment for muscles involved in mastication. As these muscles exert force, particularly during mastication, they contribute to the upward growth of the mandible. In contrast to the mandible, the maxilla follows downward and upward growth. The upper part of the V-shaped pattern signifies the downward growth of the maxilla. This downward growth is essential for the development of the mid-face and ensures proper alignment with the mandible. The maxilla's growth is influenced by sutures, especially the mid-palatal suture, where the two halves of the maxilla fuse during development. Similar to the mandible, the maxilla also experiences forward growth. This forward growth contributes to the projection of the upper face and the establishment of facial harmony. The coordination of downward and forward growth ensures the proper alignment and proportionality of the maxilla with the rest of the facial structures. Enlow's V principle underscores the coordinated growth of the mandible and maxilla to achieve facial harmony. The differential growth patterns, both in direction and magnitude, are crucial for establishing proper occlusion, functional balance, and aesthetic balance in the facial profile. Deviations from this coordinated growth pattern can result in malocclusions, facial asymmetries, and other orthodontic and craniofacial issues. Enlow's work is intricately tied to the functional matrix theory, a concept asserting that facial growth is primarily dictated by functional demands. The soft tissues, muscles, and functional matrices influence skeletal growth, aligning with the principle's emphasis on the interplay between form and function. According to Enlow, these structures guide the growth of the facial bones, further contributing to the characteristic V-shaped growth. In essence, Enlow's V principle is all about the balance of growth forces in our facial structures. This principle is a cornerstone in the field of orthodontics and maxillofacial surgery, offering valuable insights that aid in diagnosing and treating various craniofacial anomalies and conditions. Enlow's V principle describes the pattern of growth and development in craniofacial structures. It states that growth occurs in a V-shaped manner, with the apex of the V representing the area of initial growth and the arms of the V demonstrating the direction of subsequent growth. This understanding assists clinicians in predicting growth patterns, which is crucial in planning orthodontic treatment and surgical interventions. In orthodontics, for instance, understanding these growth patterns can guide the placement of braces and other orthodontic appliances. It can also help predict how a patient's teeth and jaws will respond to treatment over time. By comprehending how growth unfolds, orthodontists can design treatments that work with these natural processes rather than against them, leading to more successful outcomes. The harmony between the mandible and maxilla, guided by the V-shaped growth pattern, contributes to an aesthetically pleasing facial profile. Deviations from this pattern can result in malocclusions and facial asymmetries. In the realm of maxillofacial surgery, Enlow's V principle is equally vital. Surgeons dealing with craniofacial anomalies such as cleft lip and palate or craniosynostosis can use this principle to plan surgical interventions that respect the patient's natural growth patterns. It helps in predicting the potential impact of surgical interventions on future growth and development, thereby allowing for more accurate surgical planning and better patient outcomes. Furthermore, understanding Enlow's V principle can contribute to early diagnosis of certain craniofacial conditions. By knowing what normal growth should look like, clinicians can more readily spot deviations that may signal a potential issue. This early detection can lead to more timely interventions, improving the prognosis for many patients. Clearly, the understanding of Enlow's V principle has profound implications in the clinical practice of orthodontics and maxillofacial surgery. Its ability to predict growth patterns and guide treatment planning makes it an invaluable tool in the hands of clinicians, ultimately leading to better patient care and outcomes.